Chances are, at one point or another during this pandemic, you've had a little bit of trouble hearing somebody talking through one of these. But there are some experts who say that it could be more than just a piece of fabric getting in the way of your communication.
Hello.
Hi.
Sarah.
Hi, thank you.
What's your name?
My name's Peggy. I'm here to see Dr. Mike.
Okay.
We're constantly in situations because of the pandemic where you have a mask on or you're talking through plexiglass, and that you're just talking about the loss of sound from a mask. Can you speak to also the loss of sound through plexiglass?
Right. So, these physical barriers that are being used pretty much everywhere, whether it's at the drugstore, whether it's at the doctor's office, if you're at the checkout store, at the grocery store, all of these plexiglass barriers are also creating a disturbance to that sound quality. That sound quality is going to get reduced, making it harder for somebody to be able to understand it. There's also social distancing. They keep on saying, keep, 6+ feet away from someone. Every time sound even just travels 6 feet, the volume gets cut down, and it's going to then make it also more difficult to understand. Then you throw in some background noise. There's noise all around us, and hearing over time, not just now, hearing is always the biggest complaint, is hearing and background noise. You throw some background noise in there, you throw the masks on there, you throw the barriers, the plexiglass on there, and it just makes it so difficult to actually comprehend the message, and people are asking for more repetitions, or they're like, I can't understand anybody, and they just smile and nod, so to speak, and they're frustrated because they want to communicate with people. It's just so difficult to do that.
What do you have to say to the folks out there who say, I'm having a really hard time with this because I've noticed more so now than ever before that I might have a hearing problem? What do you say to them about getting help?
So and this is our motto for everybody, but it absolutely comes into play right now, is everyone should have a baseline hearing test. Everybody should come in and get tested just to see where you stand. Then you always have something to compare it to. But if you find yourself really frustrated, communicating out in the community or talking with loved ones, or if you notice a loved one having a really hard time, we do definitely recommend getting a hearing test. And then if by chance, you have a hearing loss, definitely treat it. Hearing aids absolutely are helping. We are having patients report back that, yep, I'm wearing a hearing aid and it's making a world of a difference. It's not making my hearing perfect, but it's definitely making a huge improvement.
Is even more important perhaps than ever before. Can you speak to what people should do in order to get help? How do they ask perhaps their primary physicians?
So pretty much every health insurance company, you can just come directly to an audiologist. There are a couple out there, but if you have a really good relationship with your primary care doctor, just say, hey, do you mind writing me a script for a hearing evaluation? We do require that for if it's just straight Medicare, but basically everybody else can just come directly to us. We would do a full hearing evaluation. The whole entire appointment takes about 45 minutes to an hour. It's painless, and we're not sticking with needles or anything. It's just a very easy appointment.
Okay, Dr. Aramini, thank you so much for your time and of course for all the helpful information.
Thank you.